Welcome to my compliance presentation. What are my duties as your compliance officer? Well, compliance officers set into place specific policies and procedures for their employees to follow. According to the American College of Healthcare Executives, compliance officers develop, initiate, maintain, and revise policies and procedures for the general operation of the compliance program and its related activities illegal, unethical, or improper conduct. What is the purpose of these policies and procedures? This standard protocol decreases the risk of legal suits, violating the company's mission, and provides guidance for the employees on how to handle situations correctly and consistently, holding all employees accountable for their decisions. Next, we're going to move on to healthcare as a moral right. Healthcare is a human right. As you know, our hospital believes that our patients have the moral right to healthcare. All patients that enter this hospital should be treated equally. They will be treated equally, ethically, and should be provided with the highest quality care possible. I am presenting to you, my board of directors, why I believe this is important and what areas we should focus on. These topics should include code of ethics, medical malpractice, and cultural competence. First, let's start with code of ethics. Every decision made in healthcare involves ethics. Therefore, there has to be a specific code of ethics set in place for all of us to follow. This will help to eliminate any mishaps and allow for more success as we continue to serve our community and carry out our mission. As your compliance officer, my first priority is to establish our code of ethics, and in doing so, I will establish an ethics committee to help ensure that these are being carried out. While every employee will have a set of ethics to follow, each position is different. Therefore, our physicians will have a specific set of ethics, such as treat each patient with dignity and respect, do not use unnecessary treatment as a means of higher reimbursement, treat the patient as you wish to be treated, and do no harm. Sound familiar? The physician's ethics will be based on the principles ethics including autonomy, non-maleficence, beneficence, and justice. Now moving on to the next topic, which is medical malpractice. As we know, medical malpractice can not only cost us a fortune, but is also an unethical way to practice medicine. That is why we have specific steps set in place as our policy and procedure to help prevent medical malpractice from occurring. For example, I have outlined 6 major steps that will help us with our policy to avoid medical malpractice. Number 1, remain honest and have an open communication with the patient, establishing a relationship immediately. Number 2, obtaining informed consent will be a requirement prior to any procedures done in our hospital. It's important not only for the patient to fully understand what procedure they're having and the risks that may occur, but also for documentation purposes later down the road. Number 3, anyone involved in documenting a patient's chart will be required to do so in a thorough manner. This is mainly focusing on the medical records part and charting and making sure that we have appropriate documentation to support everything from the patient's symptoms, disease, diagnosis, treatment plan, and any other outcomes or communicative messages, even a phone call that happens between the staff and the patient. Number 4, physicians and anyone else involved in the examination of the patient must also do so in a thorough manner. Never assume the patient is okay prior to a full examination. A full examination must be done before you can release the patient. There are instances where a patient may have something happening internally, can be revealed on a full examination, but the provider or physician does not do so. And then the patient is discharged and later on dies when it could have been prevented. This will be unacceptable. Number 5, if the physician involved in the patient's care is unsure of the patient's disease, it is their responsibility to seek consultation and refer out to somebody who does know, who does specialize in that area. Number 6, all staff members involved in treating our patients must be kept up to date on our state's laws and requirements. This is important because, as we know with the healthcare industry, they're constantly, laws and regulations are constantly changing. It's so important to stay up to date, up to code, and also continue your training every year. Next, we're going to talk about health disparities, which was not on the list to introduce, but I think it's really important before going into our last element. So health disparities, as we've learned as we know, are certain diseases that can be traced back to gender, race, ethnicity, and age. Pretty much comes down to the possibility of opening yourself up to prejudice, racism, etc. I want to work together as a team to eliminate this. Studies prove that racial and ethnic minorities are less likely to receive quality care and less likely to receive routine medical procedures, leaving them higher risk to preventable diseases such as obesity. It's important for us to beat this statistic. I want our patients to be discharged with a full understanding of why they ended up at our hospital, how they got there, how it can be prevented, and educate them as much as possible. And then refer them out to somebody who will take care of them. This topic leads us to the last element that is something I wanted to touch base on. Cultural competence, so important in the healthcare industry and is a requirement for our hospital. Cultural competence focuses on 2 of the 4 principles ethics mentioned under our code of ethics that I mentioned earlier: autonomy and justice. Our policy on this topic will allow us to achieve cultural competence within our hospital, and it focuses on 3 main actions. 1. To understand the importance of culture in our patients' lives. 2. Respect these cultures and any cultural differences. And 3. Minimize the negative consequences that arise from cultural differences. And here are my references. Thank you.